have on call, 24 hours on call. So we know that things don't happen with patients 8 to 5 Monday through Friday. That when things are happening and crises are going on and families need answers, a lot of times that isn't 8 to 5 Monday through Friday. Our hospice company is a little different than some of the others. Our nurses, our RN case managers work 8 to 5 Monday through Friday. Our nurses turn their phones off at 5 o'clock, our daytime nurses. And then we have nighttime nurses that work 5 to 8 in the morning. And what that does for us is our nurses that work during the day give really good patient care during the day. And our nurses that work at night give really good patient care at night because they haven't worked all day long. So they've gotten their medical records, they've got their computers up, and they're ready to work and deal with a crisis at night. And they're out in the field. We go out in the field in the middle of the night to take care of our patients at night. We do have an inpatient facility. Hospice is used to help reduce readmissions. We all know that Medicare is watching the readmissions at the hospitals, and they're dinging the hospitals for readmissions, and they're watching this year its hospitals are being penalized for readmissions for the same patient within 30 days, and at the end of the year they're going to penalize the hospitals. And
even if it's justified?
oh yes, even if it's justified. So they will penalize the hospitals at the end of the year if they have readmissions for the patients within the 30 days. And then next year, they're gonna start hitting the doctors for the same thing. So hospice is very important because we reduce those readmissions. Part of that is that if a hospice has an inpatient unit, which we do in Sandy Springs, anything that they can do in the hospital, we can do in our inpatient unit besides surgery. So my CHF patients, like Nellie, CHF patients retain fluid. So they need to pull fluid off of her if she's building up with fluid. We can do that in our inpatient unit. We arrange for transport from home, take her into the inpatient unit, pull the fluid off, watch her for a day or so, make sure she's back stabilized, and bring her back home. So it's very important. Not a lot of hospices invest in inpatient units, but if they have the investment in an inpatient unit, it again reduces those readmissions to hospitals. And it's huge because Medicare again is dinging these hospitals. Next year it'll be the doctors, and they're looking, I know Cindy, you guys are, the hospitals are watching you guys, your patients that are coming in, they're watching you guys to see if you guys are the ones sending them back and forth to the hospital. They're watching all of us, because in hospice, you're not tied into hospice, you can revoke hospice at any time, but if you're back and forth to the hospital revoking hospice, you're using up your certification periods. So, you can revoke hospice at any time, but you lose your certification periods. Hospice doesn't expire, but as you use up your certification periods, you have to have face-to-face evaluations with the nurse practitioners or medical directors to be put back on hospice care.